This is All India Radio. In the Year Ender series, now we bring you an exclusive interview with Dr. Sharma, CEO, National Health Authority on Ayushman Bharat Digital Mission. Interviewer is S. Rangabashyam, AIR correspondent.
Dr. Sharma, a warm welcome to All India Radio. Sir, to talk about the Ayushman Bharat Digital Mission, or ABDM as we call it in short, a lot of promises involving hospitals, laboratories and also digital health solution providers. For the benefit of our listeners, tell us what exactly is the objective of this mission?
Well, the objective of the mission is to how do you use technology to make the health services delivery more affordable, more accessible and more quality oriented. That is the broad objective. So how do you use, for example, teleconsultation? How do you, store the records? How do you digitize these records? How do you share your longitudinal health history? How can you reduce the inconvenience by kind of getting an appointment in the hospital without waiting in the line for a number of hours? So essentially, how can you use technology to basically make people's life, patients' life much better, plus provide them services at an affordable cost, in an accessible manner and with a certain amount of quality. So that's the broad objective.
But what about the cost aspect? Do you think involving technology big time, will that, kind of put the burden of cost on the government if it is not, passed on to the general public and patients?
Not at all, because what is happening is today we have a beautiful connectivity infrastructure in this country. This country has got 1 billion plus mobile connections. This country has got cheapest data rate in the world. And people are able to do 4G connections are available everywhere. So people are able to do video consultations in a very, very easy manner. You must have done your video calls to your friends and relatives. So that is not really a concern anymore. What is happening is that how do you institutionalize this entire technology kind of spread so as to integrate it with the objective of service delivery? So that's the broad part. Now, there are various digital public goods or various building blocks which we have constructed. So, for example, we have constructed the PHR, the personal health records. So, we created what is called an Ayushman Bharat health account, which is like a bank account. In a bank account, you keep the money. In the health account, you keep your digital health records. So you keep your diagnostic reports, you keep your prescriptions, you keep your medicine purchase history. So that way any doctor which actually has a look at that history will be able to figure out as to what are the kind of problems which you have suggested, which you have faced in the past. So basically that can make the diagnosis much better for a doctor. Currently you carry all these records in a physical way. Tomorrow, because of the Ayushman Bharat health account number with which all these records will be linked, you will be able to basically share these records. These records will become portable. They will become highly available to you. That's one part. Secondly, the other issue is to ensure that my health records are not seen by anybody in an unauthorized manner. So therefore, consent forms an extremely important part of this architecture. So you will be able to share your record only with your consent. Nobody else can access your record or share your record with anybody. That's another part of the issue. Then secondly, there are quacks and there are people who claim that they are, medical professionals while they don't have the degree. So we have the concept of health professional registry, which means all the doctors who have got the certificate of practice, they will be able to be there on the health professional registry, and that registry will be vetted by the government so that you know that the person whom you are talking to is a genuine doctor. Similarly, you have health facilities registry where you will be able to locate the hospitals, which is the nearest hospitals, what are the specialties available in the hospital, etc., etc. So that way, and then you will be able to do an interoperable video consultation. So for example, from your Arogya Setu application itself, you will be able to video consult, you will be able to book the video consultation with the doctor, you will be able to pay the fees to the doctor, and you will be able to have the consultation with the doctor. So that is basically the whole architecture which ensures safety, security of the data, privacy of the data, the federated architecture where we are not collecting the data at one place, and then it becomes very convenient for people to basically avail these services. So that's the broad architecture on which this ABDM is based.
Dr. Sharma, we all, discuss often and talk about, telemedicine and teleconsultation, and we do acknowledge that it has huge potential. And surely we are nowhere near that potential and it is not being used to that extent. But yes, even I have personally seen teleconsultations being done of say an eye injury where a picture was taken of the injury and the doctor could see and give an opinion. Or maybe a skin infection. A picture was clicked using a mobile phone and transmitted to the doctor, and the doctor was able to see it and give a very crucial opinion, and there was no actual need for the patient to travel to the doctor and all. With this kind of a digital intervention, can we expect teleconsultation to actually pick up big time?
You see, Rangbasim, it has already picked up. Just to give you an analysis, some time back we were having 200,000 teleconsultation on one of the platforms called eSanjeevani. Today eSanjeevani is providing 5 lakh teleconsultations per day. So I think the things have picked up. But what is being done is that now it is all formalized. Formalized in the sense that when you are just taking a picture and sending it on WhatsApp or some other medium, or you are able to do teleconsultation. Now what is happening is, once you do a teleconsultation, it will be a formal digital prescription which will come digitally signed by the doctor so that you can buy medicine anywhere in the pharmacy. So digital signatures are being used heavily on this. Number one. Number two, you can pay the money through UPI or any other instrument digitally. So that's another aspect which is being integrated into the system. So what is happening is that now we are creating a much more robust framework through which one will be able to scale up these services, which from the current level. I agree with you that we can scale up these services at least 4 to 5 times. And that is what we are trying to do. And we are actually introducing a concept of interoperability, which means that the patient can be on any video consultation platform and the doctor can be on any other video consultation platform. Still they can talk. Similar to the fact that, if I am a Voda Idea customer, I can talk to Jio customer without really figuring out whether the other person is a Jio customer or an Airtel customer. So this way interoperability will bring about a scalability in this process.
Dr. Sharma, let's now talk about the incentives per se. Tell us about the hospitals and, small nursing homes and health centers. What exactly is the incentive for them?
See, first of all, let me explain to you as to why incentive. So one is that incentives are being provided to accelerate the digitization of the entire health space. Number one. Number two, to basically make that habit change. Habit change from a paper prescriptions to a digital prescription, and to make it actually realize that going digital is not going to reduce your productivity. You can be as productive as you were in a physical, or a scribbled kind of prescription space as you are with a digital, because there are many technologies. There are technologies text to speech to text. There are technologies which can actually recognize your handwriting, and many things are there. So I think going digital, becoming digital is really something possible. And we want to change that entire habit, entire approach. Yeah. And that is the reason why we are saying that the more digitization takes place, the better it will be for the patient, because it's ultimately the patient who is the ultimate stakeholder in the entire system. So what we have done is, in various countries, people have tried different type of scheme. For example, in US, you tried Obamacare, whereby you spent billions and billions of dollars to essentially, digitize the entire health-related transactions and information. Now, we are not really going to give that kind of incentive. But however, we are in our small way, we are trying to see that most of the hospitals and labs and also the solution providers accelerate the adoption. The whole idea is to accelerate the adoption of digital technologies in this space. So we are not giving incentives to doctors per se. We are giving incentives to hospitals, to laboratories, and to the health technology solution providers. That is broadly the idea, so that it's an institutional incentive, not really a personal incentive.
Dr. Sharma, to talk about the digital mission, don't you see in a country like India, where you have a substantial population which is illiterate or semi-literate, this could be a challenge because people are not used to such things. They want something tangible, physical in form, in their hand to show to their doctors or take it to the chemist shop and buy medicines. So say, for example, a migratory construction laborer who is illiterate, will he be able to use a system like this?
Well, I think there are two assumptions in your kind of assertions. Assumption number one is that illiterate people do not use technology. This, obviously, you will yourself agree, this assertion is absolutely false.
Mobile phones are being used.
Today, Today, mobile phones are being used. People are dialing numbers. People are doing video consultations. So I think one thing is that if the technology is user-friendly, I agree with you that if the technology is absolutely, not user-friendly and technology is very obscure, then obviously people will find it very difficult to use this technology. But if the technology can be made accessible, technology can be made understandable, technology can be made friendly, then people do use technology. After all, today, people are making payments, even illiterate people are making payments using QR codes at the thelas and at the sabji walas. So it's not as if India is not using digital. India is using digital. India is on an average 17 GB of data per user per month is the highest in the world. On an average, Indians are talking 600 minutes per month per person. So I think we are using technology in a very big way. And of course, people are using Aadhaar authentication, for example, which is also a digital technology at the shops for deriving their rations in the ration shops so as to ensure the portability of the ration delivery. So technology is being used. Only thing is you must make that technology friendly and accessible to people. So that's number one. Number two, I agree with you that if the technology is not inclusive, it is not good for our country. It has to be inclusive. So therefore, everybody, people who are not using technology, they should also not become excluded by this part. So take the example of COVID. Now COVID did, provide the facility to register and then, take appointment. But COVID also provided the facility that you can go to the vaccination center and get yourself vaccinated.
Yes.
So that way, I think technology has to be interoperable. It has to be frugal. It has to be user-friendly. It has to be scalable really for a population of our size. So all these attributes have got to be there. Only then we will be able to reach to everybody, to the last man in our country. So I think we are cognizant of this fact that all the technologies which are being used, they do not put any extra burden of, acquiring knowledge on the individual. And you will see that, the main use of technology that way is by the doctors, by the labs, by the hospitals, by the pharmacies, etc. So I think that way patient is not the one. Patient is of course getting all that kind of data, linking all the data to his Ayushman Bharat health account, and he can just, show it and share it very easily through QR code. For example, today we have introduced what is called a scan and share facility, where you can go and just scan QR code kept in the hospital, and that way you can transmit all your information and you can get OPD slip without getting into the line. You can get a token number. This is happening in Lady Harding Medical College. This is happening in Charak Palika Hospital. It is also going to happen in the All India Institute of Medical Sciences very soon. So I think all that is essentially trying to, any technology which does not improve the lives of the people is useless in my view. So I think what is important is that it must help and it must be inclusive. It must not exclude anybody. And that is what we are very much cognizant of.
Dr. Sharma, the digital mission would be actually integrated completely, isn't it? From the primary health center in a village to a secondary care center and then to a tertiary center like AIIMS or any other big institute. It's across the board, it's totally integrated, isn't it, sir?
Yes, it's absolutely across the board in the sense that, this Aadhaar number, Ayushman Bharat Health Account number, is basically very, very common identifier across all domains. So what it means essentially is that once I have my records linked with Aadhaar number, I can share these records anywhere. It's portable throughout the country. It is unique for the whole country. It is not really state specific. So the portability is built into the Aadhaar number. And for your kind information, we have already crossed 30 crores. 300 million Aadhaar accounts have been created thus far. We have already linked about more than 5 crore health records with these Aadhaar numbers. So that way, I think mission is actually accelerating at a very fast pace. By the end of March 2023, we propose to have 50 crore Aadhaar number created, virtually half the population, maybe 40% of the population. And we want 100 crores records to be linked to these health accounts.
Yeah.
So that we will have a very substantial number of people having their longitudinal health history by the end of this financial year. As you are aware, the project was announced, the mission was announced by the Honorable Prime Minister on 27th of September 2021. So more than a year now, and we are progressing at a very, very fast pace. Anybody can see real-time dashboard like COVID dashboard. You can see the ABDM dashboard.
Dr. Sharma, thank you so much for joining us in this program.
Thank you.
You were listening to an exclusive interview with Dr. R.S. Sharma, CEO, National Health Authority on Ayushman Bharat Digital Mission. Interviewer was S. Rangabashyam, AIR correspondent. This program was produced and presented by the News Services Division of All India Radio. You can listen to it on our mobile app, News on AIR. This program is also available on our YouTube channel, News on AIR Official.